Hi. Welcome, welcome. Good afternoon, good evening, wherever you are. Thank you so much for joining me this afternoon on the stream. Right, let's get started. As with everything technical, there's usually one issue or the other to sort out. So apologies, my guest is having some, I think, technical issues. Let's just see if they'll be able to log in. But while they're trying to get things going, let's begin, and hopefully we'll be able to make the most out of the situation. So welcome everyone. If this is the first time that you're joining one of our live streams, I'm your host, Dr. Sylvia. I'm a general practitioner and a health educator with Askawayhealth. Interest in all things medical, a particular interest in women's health, sexual and reproductive health. So I'm so pleased to have you here, whether you're a new viewer or you are someone who's been with us before. Welcome. I hope you're having a great Sunday. On this channel, we discuss trending medical health lifestyle topics to educate and hopefully help us get the most out of life. And on our channel, we produce or publish a new video once a week and have this live stream just as an extra to get a little bit into some common health questions that we get asked sometimes. You can find us on social media on Askawayhealth. So check out our Twitter, Instagram, Facebook, LinkedIn pages, and of course our website, askawayhealth.org, and here on the YouTube channel. So all the links in the description box below. Make sure you find a way to connect with us on one of these channels or subscribe if you've not done so already. As always, I feel honored and humbled by all new subscribers. I'm so grateful that you found some value in some of the information and content that we're putting out and you chose to subscribe to us. It's really fantastic to have you guys on board. And thank you to all the members of the community. You guys know that I love you. Know that it's a team effort what we're doing here. So thank you for being part of the team. Right. So hello to Ola from Unique Space. Good afternoon. Good to have you on board. Thank you. Hi, David. Okay, I'm just going to, let me just share this link. Give me 2 seconds. And let's see what's the best way to do this. I'm just going to share the link. Like I said, our host was having a little bit of a challenge coming on. So let me see if I can forward the link to her and hopefully we can get going on things. So you guys on the chat, let me know what you think about this topic. I think it's an interesting one. If you've got any experience about postnatal depression, maybe you've looked after somebody with postnatal depression or experienced it so close by, family, friend, because the interesting thing is that it's not as rare as we think, as you'll find out as we continue our discussion. So it's really something that I think a lot of us would have something to say about, either from very personal experience or you've had someone, or you've looked after somebody who might have gone through it. But before we go into the topic, I always like to give a bit of background about why we're talking about these topics related to pregnancy. And I go back to January. It's amazing. This is the 6th episode of Pregnancy Stories. Time just flies. But I go back to January when we were discussing, when I had the opportunity to participate or observe a live discussion with some ladies on Twitter, and they were sharing some of their concerns about some complications that women might experience in pregnancy. And let's see. Okay, give me a second. I'm just trying to, okay, Helen, I'll post the link. I've just sent it to you. Yeah, okay, I'll send it to you again. So I've just sent it on the chat. So if you can pick that up, which Yeah, if you can pick that up, let me know. I've also sent it to you on WhatsApp, so hopefully that should connect for you. Okay, yeah, so we had these ladies were talking about the experiences during pregnancy and after childbirth. During pregnancy and after childbirth, and a lot of the concerns were, oh, there are so many things they never knew, they never thought could happen, and I wish somebody could have told me. That was the overriding feeling. And so I thought, well, this is a good opportunity to engage and create a discussion around some of these things that women can experience in pregnancy or while after they've had their babies. So we decided to look at different topics, and we've looked at breast issues, we've looked at perineal cuts and tears. Oh, I heard a sound. Looks like, oh, fantastic. Okay, I think we might be getting something going. Hello. Hi. Hi there. Great.
I'm fine, thank you. Can you hear me loud and clear?
Yes, I can hear you loud and clear. And thank you. Unique Space is saying good topic. That's fantastic. So, yeah, where was I? Okay, yeah, I'm going to introduce in a minute Dr. Helen, but let me conclude on this bit. So we've looked at a few topics in pregnancy stories already. We've looked at breast issues. We've talked about perineal cuts and tears, episiotomies, vaginal discharges that women could develop, irregular bleeding after birth, and things like urinary incontinence. So if you're interested, and if you're interested, make sure you check those out. I'll put the links in the description box, of course, and you can have a look at those topics if they're sort of relevant or specific to you. But today we're talking about postnatal depression. And the fantastic thing is I have a special guest to look at this really important topic with me. So thankfully we overcame the gremlins. We overcame all the gremlins of technology. So I have a very special guest with a lovely personality, and she's going to help us to explore the issues around postnatal depression and help us talk about the ways that we can treat, and in particular focus on self-help tips as well. So I'm very pleased to introduce Dr. Helen Ogunsanwo. She's a general practitioner and the anchor of the YouTube channel, NewWine Platter. So Dr. Helen, welcome. Welcome to Askawayhealth. It's great to have you here. Please tell us a little bit about yourself.
Okay, my name is Dr. Helen Ogunsanwo. I am a general practitioner that practice in the UK. I'm very passionate about women's health and also mental health problems as well. So kind of like, this is like a combination of both.
Absolutely. That's fantastic. Yeah, so tell us about your channel. I know you have a great YouTube channel. It's called NewWine Platter. So tell us about the channel. Tell us what you talk about and what you do on the channel. Hype it for us.
Okay, so I've got a YouTube channel called NewWine Platter, which is just like a lifestyle based channel, which I do everything of everything. So everything like a little bit of everything, lifestyle, parenting, motivation, just everything about living generally.
Absolutely. It's a fantastic channel and I'd recommend it. And guys, I'm going to put the link to NewWine Platter in the description box for this video. So make sure you go and have a look, check out some of Dr. Helen's videos there. Encouraging, inspirational, educational, the whole mix. She's got them there. She's got it all there. So let's get cracking into our topic today. There's a lot to go through and hopefully we'll try and touch the most important points. We're discussing postnatal depression. And before I start asking or engaging with Dr. Helen, I just thought let's define what it is. What's postnatal depression? So it's a depressive illness. And when I say depressive illness, most of us know what depression is and can sort of have an idea of what depression is. It's a condition, a mental health condition that has so many different symptoms involved. And postnatal depression, you're talking about depression that happens in the context of pregnancy and delivery. So that's, I think, an easy way to say it. I just want to quickly or briefly look at the, I'm just going to briefly look at I want to see if I can share my screen. I wonder if I can make that work. Let me just see. see if I can make that work and share the screen with you. And if I can, then you can sort of have a look at the symptoms while I'm talking. So just give me 2 seconds while I do that. So share screen, and then we can get that on board. So I just want to have a look at the symptoms. So hopefully you'll be able to see part of my screen. Yeah, so not as big as I'd love, but okay, let me just make it. Okay, fine, let's do it this way. So hopefully you can see some of the points. There are quite a number of symptoms, but if somebody is experiencing depression, and specifically postnatal depression, they might go through low mood, feelings of guilt, regret, feeling poorly motivated, not having interest in things that they normally, or in the past, they were excited to do or they love to do. So they don't have interest and they don't enjoy the usual activities or hobbies that they had. They might experience feeling very tired and exhausted. They might feel irritable, develop headaches. They might experience loss of sexual desire and libido. They might experience negative thoughts. So the mindset and the thinking is sort of negative. There's nothing optimistic and happy about the way they think. Other symptoms that they, or other feelings that they might have include feeling hopeless, anxious about things. They avoid others. And then in connection, special connection with the baby, there might be thoughts about harming themselves or their baby and not wanting to look after the baby. These are some of the symptoms that people experience when we're talking about postnatal depression. So in some cases, and we'll look at this to some extent in the stream as to when it actually happens, but a lot of the times, usually after the baby has been born. Now, experiencing these symptoms, and this is the way we say this is someone who's got postnatal depression, experiencing these symptoms for longer than 2 weeks, so for more than a 2-week period, indicates that somebody is going through postnatal depression. So, so now that I've shared with you a little bit about what it is, let's just jump in and bring Dr. Helen in, and hopefully, we can engage in some kind of discussion. So, Dr. Helen, what do you think in terms of postnatal depression? How is it different? Is it the same? Are we talking about the same thing as normal or ordinary depression, or is there something that's a bit different when you're talking about postnatal depression?
Okay, I have an interesting answer. I'll say yes and no.
Great.
Yes, because it features depression and has some signs which you would find in other non-pregnancy related depression, but no, because it is specifically associated and triggered by the birth of the baby, and you will not find that in other forms of depression. So I'll say essentially, postnatal depression is depression in new mothers.
Yeah, that's great. I think it's difficult to give a yes or no specific answer, so it's a mixture of the two. So I think I would agree with you. So in that case, then when does it happen? I know you've mentioned it's related to the birth of the baby. Is that the only time people end up with postnatal depression, or can it happen at some other points? What kind of timeline would you expect, or have you observed people to develop postnatal depression?
Okay, so it usually starts within the first 4 to 8 weeks of birth, and as you said, I don't think, but I saw that on the slide. It affects 10 to 15 women out of every 100 women.
Yes.
So we know that 1/3 of women with postnatal depression have symptoms which starts in pregnancy and continues after birth. Okay, I'm just going to give a brief kind of like intro into what postnatal depression is.
Yeah, please.
As we know, having a baby is a big life event. And there's usually huge changes physically, emotionally, psychologically, and socially. And so women can experience, it might be natural for them to experience like mixed reactions and feel, have a range of emotional feelings after delivery. Over half of new mothers will have what we call baby blues. And this usually starts in the first 2 to 4 days of after birth, where the mother feels overwhelmed. She feels like she's having mood swings, overreacts, and starts to cry. And this is usually caused by changes that comes with the birth of the baby, having a new baby, and also hormonal changes, also stress and fatigue and things like that. And ideally, baby blues should peak around the first week and taper off in the second week, so that it ends by the time the baby is like 10 days old. But if it persists or lasts longer than 2 weeks, or it becomes worse rather than getting better, then this is called postnatal depression. So postnatal depression is a more severe form of baby blues, and it lasts longer than baby blues.
That's great. I'm glad that you brought up baby blues, because sometimes it's a term that we just sort of throw into the discussion. Oh, it's baby blues. And I'm really glad that you've defined it and separated it so that it's clear. So some women might have baby blues after the baby is born, and that doesn't mean that can resolve. That those feelings can settle after some time, usually within days or weeks. But it's when it becomes persistent, so when it goes over a particular period of time, and when the symptoms or the symptoms associated are more severe, is when we're then talking about postnatal depression, right?
Yes.
Okay, so I think that leads us nicely into the next point. I think is really important, because in some people, or in some parts of the world, I think is the better way to say it, there's a lot of awareness about postnatal depression, but not so much in countries like Nigeria, West Africa, where talking about mental health issues, there is still some kind of stigma, I think is the best way to put it, and some kind of some cultural taboos. It does exist. So this is not a condition that is just limited to a particular group or race. It can happen to anyone, but it often goes underreported, particularly amongst some Africans. Why? What do you think about that? Can we explore that? What's the reason? What's happening currently in terms of trying to deal with it or trying to reverse it? What do you think?
Okay, thanks for the question. I think it's absolutely true. I agree with you that it often goes unreported, especially in places like Africa and sort of underdeserved areas. So a lot of people are not aware of what exactly it is. I'll say is the major reason, and that's why information sharing platforms like this is very important. The other reasons why it isn't talked about and why women would unwillingly not disclose it is because of the stigma attached to it. Perhaps it connects a negative message that they're not good mothers. Also, the worry about what others will think. And also worry that people might kind of like term it as postnatal psychosis, which is a more severe form of mental illness. And many of them just feel like, well, maybe it's just a normal way to feel after you've had a baby.
Great points. You raised very good points. And that makes me wonder then, and I think you touched it when you were defining what postnatal depression is, about the cause. What makes Lady A, Angela, develop postnatal depression? Why is she more likely compared to Lady B, Kemi, who didn't? What's the difference? Can we sort of put it into a box and say, okay, this person is definitely going to get it and that person isn't? So I'm just trying to ask, what are the common causes for postnatal depression before we then look into just look further into what families and friends should be looking out for? What do you think?
Okay, so what would make a woman more likely to develop postnatal depression is kind of like the associated risk that we have. So there's so many risk factors that would make a woman more prone than the other woman. So I'll just go through a few of this. One is a previous history of mental health problems. Also, if the woman has had depression or anxiety during that pregnancy. Note what is also good to take note of the fact that there's so many social circumstances that can also make one more prone to it. Things like having poor social support, having poor or little or no support from your partner, from your family members, from your friends. Living alone and being isolated is another form. Also having relationship problems with your partner. Maybe at that time there was a breakup. Maybe the woman broke up from her partner. Also recent major life events like bereavement, losing one's family member, or even if a member of the family is terminally ill, that can also make a woman more liable. Also, things like job losses, relocation to a new environment. History of sexual abuse and domestic abuse is another very important one. Stress, financial problems. Also, if the baby is unwell, the newborn baby is unwell and admitted into a baby unit, that would make the woman, more prone. Also, if the woman has had like pregnancy complications or birth complications during delivery, substance misuse and alcohol, drug misuse. These are very, very common risk factors. Also, family history can run in family as well. And there can also be organic causes like thyroid problems, vitamin B12 deficiency, and things like that. Another thing to take on board also is ongoing health problems. So, say for instance, the woman is diabetic, or she has long-standing health problems. That's another risk factor.
Fantastic. So what I'm getting from this is, and I think it also ties to how common this problem is, because it's one of those things that doesn't just sort of scream about itself from the rooftop, but actually we're living with it. And my research, I don't know what your findings suggest, is that 1 out of every 10 women, this is how common this problem is. And from the list of causes that you've listed, it could literally happen to one person. They could be fine, but then undergo one of these stresses that anyone could go through, bereavement, for example, or domestic problems. Anyone could go through that. They don't have to have a previous history of depression. Although, as you said, people who have had depression in the past or who have a family history may be more at risk of developing it. So I think it's really important in getting that message across. And to an extent, it's not one person's fault. It's not something, and I think it's important for couples who go through this as well. Like, it's not one person's fault. Outside of things like abusing substances, so taking drugs of abuse or excessive alcohol use, some of these things you cannot sort of prevent it. It may just happen, and you cannot actually go back and say, oh, if I'd not done this while I was pregnant, I wouldn't have ended up with it. So there is some of the guilt that some women might experience, and that might also lead to failing to disclose their feelings and getting the right treatment. So I'm glad we've covered that. In terms of the family setup or the network, just think of a young couple, maybe married a couple of years, have had their first baby, and you've got the doting relatives here and there. Think of the African setting and how family are involved. What kind of cover up have you, experienced or heard of or observed? Cover up in terms of there's a problem here, but nobody's talking about it. Can you share anything in that light?
Well, I think, as I said earlier, a lot of people are not fully aware of what exactly it is.
Okay.
And that's why it's important that we know the symptoms. And I feel like the crux of this live session is for us to be able to be aware of it, for us to be able to identify it, and for us to be able to address it. Okay. So, depending on the severity, it's possible to cover things up, where they basically don't even know what is happening. They just feel like, okay, it's just one of the stresses that comes with having a new baby and things like that. So typically you can have a different scenario of presentations and things like that.
Absolutely. I think when I was going through, I thought this was really useful because it really, so I'm just going to share that and read it out because I've got 5 or 6 points about what the women who experience postnatal depression actually feel about the baby. So in addition to the list of symptoms that I'd shared earlier, I'm just going to put that on here, and then, we can have a quick look at it and, see what you think. So let me bring that up. So hopefully you should be showing that screen. So there might be feelings of guilt that you don't feel the way that you expected to. So of course you expect that a new mom, you love your baby. That's natural. But there's the guilt that you don't feel the way you're supposed to feel. And then there's the fact that that love, that's automatic. We think it's automatic. That might not be there. That love that you should have for your baby. You don't feel close to your baby. They might find it hard to work out what the baby's feeling. The way the baby's crying like, oh, they're hungry, or, oh, this cry means that they need change, this cry means that, but it's difficult. Or they might resent the baby or blame the baby for the way that they feel. And they might have feelings as if they are missing out on motherhood. And the reason I share that, and goes to what you were saying, Dr. Helen, is about people not knowing what it is, what to look for. So apart from the tiredness, the headaches, the feeling anxious or irritable, and so on and so forth, there also this, if you notice this kind of dynamic, it's different to what you expect, then that should ring a bell. I don't know if you wanted to add anything else to that before we go to the next question.
Yes, I think you said a lot of some of the symptoms to look out for. It's a barrage of symptoms, really. So the low mood, feeling sad, tearful, feeling distressed and down. Sometimes, a lot of times, they're also anxious and nervous, feeling on edge. Also having negative feelings and constantly worrying about maybe the fact that they're not good moms, worrying about the baby's health. Also, they can have loss of interesting things, loss of pleasure. So instead of just having that excitement of having a new baby, they're not feeling that excitement. They're unable to enjoy the process.
Yeah.
Also, they could have like poor sleep, loss of appetite, tiredness, like low energy levels, poor concentration. Also, having a really low self-esteem, feeling worthless, guilty, and hopeless for no clear reason, coping with tax, and tax becomes really very difficult to manage. Avoiding family members, just shutting everybody away, just wanting to be on their own. They could also have problems, as you said, bonding with the baby. They just cannot just connect with the baby. They could also have thoughts of self-harm and thoughts of harming the baby, and can also become suicidal as well. All this as the symptoms that accompany postnatal depression, and also low sexual drive as well can also be a feature.
Absolutely. I mean, you can imagine how these things can impact on a couple's relationship, and then can cause even more stress, because they're not thinking about an illness, they just think it's somebody's attitude. So it's really important that we're talking about these things. Okay, fantastic. Dr. Helen, let's just go into the chat, because there's some questions. I don't know if these are fair questions, but there's some questions. So let's try and tackle them. So from David is saying, is the age of the woman a factor? Is the woman's age a factor? So that's interesting. So is she more likely to develop postnatal depression in her teens, or is she more likely to develop it in her 40s? I don't know. In terms of age, I think going through all the causes that we've listed, a lot of them could happen to people at any age. So it doesn't really specify it's more likely to happen when you're younger or older. I think a lot of them, I don't know what you think, but a lot of them seem to be issues that can just drop or land on people. If you've got a family history, it might be that the mental health problem comes up a bit later on, but it's there. What do you think?
I totally agree with you. My answer to that question will be like, it is universal. It's not kind of like associated with the age of the mother, the race of the mother. So it's universal. It can happen at any age. It's not something associated with maybe like older pregnant women, or things like that. So
absolutely. And from David as well, very good point, because we're trying to educate and raise awareness. And he says, is postnatal depression the same as postpartum depression? Which I would say yes. A lot of these terms that we use are medical terms, and people can't relate to them. So absolutely yes. Partum refers to birth, delivery, being pregnant. So post. Even though in my research, I found that it can sometimes, a small degree, start in the pregnancy.
Yeah,
and that might relate to women who, as you say, have a family history or have suffered with depression in the past before they got pregnant, or it might just develop along the line as a new problem during the pregnancy. So very, very useful, very, very good contribution from Dental Storm. Thank you so much for joining in. He says, my wife also went through it after she had her first child. She alluded to it as being a new parent and not being used to hearing a constantly crying baby. And that's interesting, because if I think for one who experiences this, you're trying to work out what's going on, and you have to explain it to yourself. It has to make sense to you, and you're trying to work. It's really a painful place for a woman or even a couple to be in, trying to understand what's going on. So yeah, thank you for sharing that. And then David comes up with another question and says, could there be is there a relationship between postnatal depression and fidelity? Over to you, Dr. Helen.
Thank you so much for that question. I did note in one of the risk factors that one of the possible things that can trigger postnatal depression is a breakdown in a relationship with the partner. So say for instance the partner is not there for that woman, or maybe the partner, there's infidelity in the marriage and the partner has kind of like been swayed away by another woman. Yes, absolutely, it can be one of the triggers for depression.
Yeah,
I also
absolutely.
want to add something, and I think I should put it out there as well, that men can also have paternal depression after the delivery of their babies.
Right on, right on. This is another table that will need to be broken because getting their heads around it. But it's true. There is evidence that men, in the context of having their wives being pregnant, can also suffer depression, and so it's recognized that men can experience that. So very good. Thank you for putting it out there. So hi Lucy, welcome to the stream. Says it's an interesting topic. I can relate. Then David says, could there be, I wonder where he's getting all these questions. Could there be a connection with the socioeconomic circumstances of the family? I think you mentioned that? Yeah, because yeah, absolutely. Because
so much so.
Yeah, so there's stress. That puts stress. Wondering where you're going to, there's an extra mouth coming, how you're going to look after the baby. Go on. I think you want to jump in.
Yeah, absolutely, because you've just had this new mom that's just had this baby, and then she's thinking in her head she cannot even afford maybe infant formula. She doesn't know where she's going to get the next purchase of diaper from, things like that. That's just adds on to whatever is going on with her having the new baby, and is one of the major risk factors.
Exactly, absolutely. Fantastic. So I think we've really sort of looked at the causes, we've looked at the circumstance, who gets it and how often it happens. Let's then sort of narrow it down as we sort of start coming to the end of this and talk about getting help. The first question then, now that we recognize this problem, does it go away by itself? Do we just do nothing? Can we just sort of, give it time and, just see how it goes? What do you think?
Okay. A lot of women would get better within 3 to 6 months of having postnatal depression. So it's something that can go away on its own. But we know that 1 out of every 4 women could still end up having depression by the time their baby is a year old. So needless to say that we still need to address it. It needs to be looked into. It could go away on its own, but we need to put certain things in place and address it properly so that it does not escalate and gets worse.
Absolutely. So I think what I'm getting from that is in terms of treatment, as in, okay, going to the hospital or admitting someone to hospital or taking some medication, it might be that things settle down. But I'd like to emphasize that there has to be a context of support and understanding, which one will get from a network around yourself. So, the family, friends, understanding what's going, and then getting the assistance, because this is one of the busiest times of a new mother's life, and you're trying to get used to pattern and everything else that the baby is doing, because the baby takes priority now and you're sort of working around their pattern. So it's really important to say that I think the key thing is to find out what's going on. So when you notice some of these symptoms that we've talked about, either this strange behavior with the baby or any of these other symptoms like low mood and feeling anxious or hopeless, speak to a doctor or speak to your midwife. That's the first, that would be the first thing. Speak to somebody who has some medical training, and because we want people to know that these things are out there. It's not just somebody's attitude. So speak to somebody who is medical and talk to them so that there can be an assessment and we can work out how severe is this problem. Is this something that can be managed to an extent at home without needing treatment? Because there are some cases, just like you said, Dr. Helen, that will need some treatment. I don't know if you want to add anything more to that. Otherwise, I'll just jump into the next question. Are you good?
Yeah. I want to say that it's very, very important, not only for the mom, the new mom, to know that, to be aware of these symptoms. Also, the family members, the partners, the friends, they need to be aware of these things. And it's not a time for them to just say, oh, what's it called? We'll just take a step back and just leave her to be on her own. It's
Yeah.
time to actually speak to her, to open up, to offer support and help to her.
Absolutely. Okay, so just going back to the chat, Ola is saying she's confirming that it is not associated with age. And we have a contribution here from Lucy, which is interesting. It says, my heart skips intermittently and I'm 6 weeks post-term. What could be wrong? Right. Okay, Dr. Helen, what do you think? For me, a lot of symptoms that you get can reflect so many different issues in the first instance. But what do you think? How do we start approaching this this thought?
Okay, so I'm just, because I'm not able to read the chat, so I don't know what she's put on there. So she's just saying that she's
having... let me just put it on. I don't know if you can see it. Yeah, is that okay?
All right, okay. So she said, my heart skips intermittently and I'm 6 weeks postpartum. Okay, what is wrong, doctor? A lot of things can be wrong. I cannot just take this single symptom and then start to tell you what exactly it is. I would advise you to talk to your care provider, because it can mean so many things. It can mean depression, it can mean anxiety, it can mean problems with your blood pressure, it can mean a lot of things. You want to rule out things like heart problems and things like that. So I don't want to make any diagnosis over online today.
Absolutely, yeah.
But if you think that the symptoms that we talked about today, you feel like it's ticking some of the boxes for you, then it might be that you're having what we call postnatal depression. So I think you need to speak to your healthcare provider.
Yeah, absolutely. I agree. I think with any symptom, anything that's unusual, if you've just had a baby, please speak to your doctor, speak to your midwife, because then we can tease out what else is going on. And many different conditions can result in skipping heartbeats, and so we can't say this is definitely what the problem is. And then one more question from the chat before we then go and look a little bit more about treatment, and is from our good friend David again, saying, considering, I'll just show it to you so that you can read it as well. Considering how serious for the mother, baby, and the family postnatal depression is, are there any matrices that healthcare workers can follow so as not to miss the diagnosis? I think that's a great question, actually, and it's one of the things I wanted us to bring up. You take first grab at it, and then I can come on after you finish. Tell us what you think, Dr. Helen.
So, because we know that this is a big deal, to be honest with you, we're still going to talk about the potential complications of having postnatal depression. So the healthcare system is fashioned in such a way that we pick up on these risk factors. So we identify these risk factors. So say, for instance, the woman who had previous postnatal depression in a previous pregnancy, we take that on board. Any family history of depression or psychosis or mental health problems, we want to know what the social circumstances are. So we take all these things into context, and they're able to kind of like triage and see if this woman is high risk for having depression, and the midwife can now then monitor her and regularly and keep a surveillance. So if, for instance, she falls into the high risk area where they're worried about her social circumstances, how she is presently, because a lot of times we already know, say for instance, the woman is isolated, she's living alone, and several other social circumstances, we kind of like can hone on and say we need to be careful of this woman. So they put all that into context and make sure that they monitor, they offer support, they signpost her to support groups and things like that. So yeah, the medical system has a way to put this in place, and they also offer a lot of support after delivery, just to make sure that she doesn't really come down as bad.
Absolutely. I completely agree with you. And I think I'll just like to add as well that it's something that we should be proactive as medics, should be proactive. We need to be looking for it, because if 1 out of 10 people, that's too
That's a lot.
frequent. I can't think of anything else that's 1 out of 10 that we sort of take for granted, but that's a lot. And one of the things that we do, and the opportunities when you as a doctor can speak to your patient, or the nurse can speak, or the midwife can speak to the lady. For example, if they've not had a C-section and you're not reviewing them for that, maybe when they come for immunization, you can catch them and you sort of you're looking for it. Yes, exactly. So if we take that in mind and not just assume that, oh, she's turned up, she's nicely dressed, she's looking everything all put together, she's smiling, and not just assume, but actually ask the question, because don't forget, they're trying to cover it up because they don't know what's going on, and okay, maybe it's just something that will pass, and they're just blaming her for, oh, she's being. Some people even say they're being lazy. I think it's so painful because it's such a tough thing for women and their partners to go through. But anyway, so the doctor or the nurse asking, how are you feeling? Are you sleeping well? Are you feeling low? Are you feeling down? Are you getting enough support? Asking some of those probing questions and actually looking for an answer. And explaining to our mothers that we're not asking this to embarrass them or because we think they're not up to it, but because this thing is so common and it's treatable. And the earlier we get on top of it, the better you feel better. You can do so much more for yourself, your baby, and your family. So absolutely.
Dr. Sylvia, can I just say something quickly?
Absolutely.
About you mentioned something about cover up, and I just want to from my own practice, just add something to that. A lot of women, supposedly you see them well dressed, trying to cover up underneath how they're feeling. And so I totally agree with you that when you have that chance as a doctor, as a midwife, as a nurse, as a family member, as a parent, as a partner, from time to time, you should ask from these new mothers, how do you feel? Because I've had experiences where a woman just turns up for maybe something else, and I just said, oh, you've just had a baby, oh, congratulations, and you just probe a little bit further and just ask her, so how you bonding with the baby? How is your mood? And then she starts to break down and cry.
Yeah. Exactly. Yeah, you have that, perfect makeup, and then you ask the question, and then the mascara starts to go. Yeah, I take that on board. But it's true. It's really, really, that's a great point that you've made. Absolutely. Okay, so I'm going back to the chat because they're coming up with all manner of comments. So let me bring this one up. Okay, so this is from our friend Dentist Tom. Do you feel the need for a holistic approach to postnatal care, especially in terms of involving the psychologist to talk to all women in order to create awareness? What do you think, Dr. Helen?
I don't. Well, in some places, I don't think it'll be possible for the psychologist to talk to all the women. But I think that as health caregivers, you can provide information and create awareness whereby you tell these women that, see, 1 out of every 10 women will end up having postnatal depression. These are the symptoms. If it happens, or you start to feel overwhelmed, or you're feeling really, really emotional, tearful, and it's starting to impact on your life, please keep the communication line open. And also, not only that, early on, quickly signposting them to where they can get helps, group sessions with other pregnant women or women that just had their babies. Also, getting family members on board early, and this would go a long way to kind of like resolve some of the issues.
Absolutely. I think it's a great comment. And yes, you might not need to get a psychologist involved with every single woman, but as you said, the awareness, antenatal classes, this should be one of those topics discussed, and remove the stigma, just deal with it and open it up because it's that common. And Dental Storm goes on to say, goes on to comment, methinks ensuring healthcare workers provide postnatal support in terms of hospital appointments would help mitigate the risk of depression. Yeah, absolutely, which is what we are saying, isn't it? So looking for the problem. Okay, so I'm just conscious of
time. In the UK, in the UK, we have midwives going to visit these women after delivery. From time to every few days, they go to visit them and then ask them all these questions.
Yes, absolutely. So it's a good practice, just given just how common it is and how debilitating it can lead to. So let's talk about treatments. Let's use the final few minutes of this stream to talk about treatments. So we've said that yes, sometimes it can settle down, but I know that there are cases where we do have to treat. what can we say to a woman who needs to have treatment? So she has postnatal depression to the degree that is severe enough, and you're thinking as a doctor that she needs to be treated, particularly in terms of drugs that she can take, and she's breastfeeding. What kind of comments, what kind of issues go around that?
Okay, so let me just quickly say that it can be classified into mild, moderate, and severe. So if it is if a woman has mild symptoms, she necessarily does not have to be on a medication. We have things like self-help techniques, talking therapy, and maybe down the line she can have what we call CBT, which is a high intervention therapy. So let me just quickly talk about a few things that can be done for the mild cases. Things like just taking a break, taking a rest, having routine, delegating, other tasks to other family members like shopping, cleaning and looking after the other children, so that she's not having to do everything and she can take rest and breaks. Also talking a lot more, being open and venting, talking about how you feel to your partner, to family members, and just venting will take a lot of all this. In a lot of people, just even talking about it is a form of therapy, and they just start to feel better that they've offloaded all the burdens in their hearts.
Absolutely.
Also talking to the midwives and also to the doctors as well. I don't think you have to start to wait till when it impacts on your quality of life before you talk about it. Even if you're just feeling a little bit overwhelmed, just talk about it to your midwife, and they'll be able to give you all the support. Also, like when a woman has just had a baby, they just feel like, oh, it's a major child event in their life, and then their life is put on hold. No, you have to enjoy the process with the newborn baby. So you listen to music, you take the babies on walk, you do whatever makes you happy as well. Also spending time with your partner, all this would also help as well. And it's a time just to kind of like have a routine. So maybe you just create a routine and just say, okay, this is my breastfeeding time. This is when I express. I'm getting the whole family to help you, and that would really help. So for women that have mild to severe cases, they're feeling like, oh no, I don't want to, and they've been prescribed medication and they're kind of like concerned about starting medications, I would say to them that there are lots of antidepressants that are safe for breastfeeding mothers. Why? Because they're poorly excreted in breast milk, and we have a few of these antidepressants. So even if the doctor feels that, you know what, we feel that self-help techniques will not be able to help you, you have to go onto medication, they should be reassured that it has been used for so many years and that there's really nothing major to worry about.
Absolutely, that's a great point, because I think it's a focus of anxiety, and reasons why somebody would not want. They'll think, oh, they'll tell me to start taking tablets and I can't breastfeed my baby. There may be such concerns if the lady feels that way. What about when it's severe? How could it affect the family context if somebody, for example, somebody's having those kind of thoughts? Now we're talking about postpartum psychosis, which I know is quite different. Very severe symptoms, but in terms of how it affects the family structure, because it may be that they leave it and then things just go haywire. I remember during my early training days, I did have someone that we had to admit. She just had a baby and we had to admit, and they're such a lovely family, and you could see the bewilderment in people's, when they come at visiting time, there's a whole host of people coming onto the ward to visit this lady. And it's the bewilderment. They're sort of huddled in groups and not knowing why they're there or why she's there and that kind of a thing. But if somebody then has to be admitted to hospital because we think she's not doing well on tablets or for some other reason, how do you think it affects the family dynamics and things going forward? Is there hope, is what I'm trying to ask.
Of course there's hope, there is hope. What's it called? Postnatal depression or even psychosis is an illness like any other kind of illness. So it doesn't mean that the end has come. It doesn't mean that the end has come. It just takes a lot of family involvement, family, care, the family to understand what is going on, and hopefully the woman will be able to pull through.
Absolutely. Okay, great point. So let me just do a quick dip into the text and then we will start to round up. Dr. Helen, if there's anything else that you want to chip in, please just think about it while we're looking at the next couple of questions. So I think, I don't know if we've shared this already. Comment from Dental Storm saying, I think ensuring healthcare workers provide postnatal support. I think we've looked at that. And
we talked about it.
Yep. Then David goes on to say, in a developing country context, would group ANC, antenatal care, and group postnatal clinics be helpful at all regarding postnatal depression? When you say group, I mean, postnatal antenatal clinics are usually done in groups, aren't they? So group postnatal clinics is a different thing, because that's not so common, is it?
In the UK.
Yeah, or even in the context of maternity clinics or postnatal clinics, immunization clinics, I think, are opportunities for I'm thinking of, in countries that have different healthcare systems to the UK, like Nigeria or Ghana, for example. It might be at immunization clinics, so you have mothers that are gathered together. So you could use the opportunity, the nurse or the doctor could use the opportunity to give a 5 or 10 minute discussion about it. And I think that would be a good way of pushing that information out to people. Then a comment from Dental Storm says, in the developing world, especially where I am, postnatal care isn't robust, unfortunately. Okay, so that is the reality of our times, and that is why discussions like this and those going on in different fora are so important, to shed light on this thing. So, on this condition. So we're at the end of the stream. Thank you so much to everyone for the comments. I just want to reference or buttress what Dr. Helen has said in terms of treatment, and you touched a lot of points about self-help, and I'm not going to sort of go over everything, because we've developed, Askawayhealth has developed an ebook with self-help tips for dealing with postnatal depression. I'm going to put the link in the description below, but I just wanted people to know that we do have that. And if you're interested in some of the information that Dr. Helen shared about what you can do to help, to look after yourself, to reduce the impact of postnatal depression, exercise, eating properly, getting enough rest, accepting help, speaking out, and so on and so forth, please check out that link. It will be in the description box for this stream. So one more comment here from Dental Storm saying, I guess the family has a responsibility to help identify postnatal depression. Well, what do you think, Dr. Helen? Are we putting an unfair burden on the family?
No. I think if you look at it, as I said earlier, sometimes family just feel that, oh, it's time to just maybe leave the new mom to be on her own. Maybe she's having to undo too many things, but it's actually a responsibility of the spouse, the family members, and the friends.
Yes.
To kind of like walk with her, see how our countenance is, see if they need to. I think it's a time for them to offer support, to offer help. It's not until when she comes to say, oh, I'm struggling, offer to maybe go and do our shopping, offer to maybe drop off the kids, or even have the kids, maybe if she has older kids, just to give her some sort of respite. Ask her if she needs, help with cooking, and just see how we can offer help and support. Talk to her, ask her how she's doing. Is she sleeping well? Is she eating well? Things like that. I feel that a lot of responsibility also lies within the family in that context, to help and also to avert postnatal depression.
Fantastic. Thank you so much. On that beautiful note, I don't really have anything else to add. Dr. Helen, do you want to add anything more on the topic? If not, then please, okay, go on. If you want to add, say anything, if there's anything else you wanted to add, please.
Yes, I want to say that postnatal depression is a big deal. Even though a lot of people are now aware of it, but it is actually a big deal. And the reason is because it has the potential to quickly escalate and potentially it can go out of hand. We've had cases where, things can get worse, and then the woman becomes suicidal, or she attempts suicide, or actually even commits suicide. We've had cases like that. I don't know if Dr. Sylvia, but we've had a lot of cases like that. And so we we do not take it lightly. So, and you never know, you cannot tell who is going to quickly get better and who is going to go ahead and deteriorate. So all hands has to be on deck. We have to make sure that we're supporting. And with a lot of women that I've had in my practice, I've had with postnatal depression, bringing them for routine visits, maybe weekly telephone calls can go a long way. And I found out that just even talking about it, by the time I get to talk to them again the next week, they're like, "Doctor, do you know that just sharing how I felt with you has just made me better?"
Yeah,
and then just telling them, giving them little tips there and there, exercising, make yourself happy, and all of that. They just feel like they're now in control.
I think just sharing with someone and just knowing that actually I'm not a rare specimen and I'm the only one this is happening. I'm a bad mother.
Them.
Yes, I think that is so vital. So that's fantastic. So we've gone through what postnatal depression is, how common it is, who it affects, its causes. We've looked at how it can be recognized. We've talked about the symptoms and we've looked at the treatments and importantly, the role of family and friends in postnatal depression. So please, if you're watching this stream on replay, these are the points that we've talked about. If you've got any questions, feel free to put the questions and then we'll be sure to get them addressed for you. I think someone just put in, here's a comment from Ola. So let me just share your comment, please. Family could be very helpful in understanding where to really help and when to give couples breathing space. Absolutely. Totally agree with you. Okay, right. Thank you so very much, everyone who's been part of the stream. I would like to thank my beautiful guest today, Dr. Helen. You've been absolutely fantastic. You've really shared a great amount of understanding and light on this topic, how important it is. And I'm sure that those who've listened to our chat and our conversation sort of have gone away with some kind of better idea about this, because it's not something that's just far off. It's something that's actually here with us. So before we go, please tell us again about your channel. Tell us what you're doing. What's the next thing happening on your channel? What should we expect on the channel next?
All right. Okay. Hopefully, I hope to do some exciting things. I'm a little bit varied. Like I do a little bit of everything, a little bit of lifestyle, health, what to call parenting, cleaning, motivation, and things like that. Hopefully, I want to do a bit more of interviews. And hopefully, I'll be doing a lot of collaboration. So hopefully, yeah. Watch the space.
Yeah, absolutely. So the link for Dr. Helen's channel, NewWine Platter, is in the description box. Just go to her channel, show her some love there, appreciate what she's doing. Don't forget to like this video and subscribe to our channel here on Askawayhealth. We provide you with information on anything medical health related. That's what we're all about. So thank you so much for joining us, guys. Dr. Helen, God bless you. Have a great week, everybody, and see you soon. Bye-bye.
Thank you. Bye-bye.
Bye.